There's no harm in waiting if you're considering a partial knee replacement to have the surgery, especially to make sure that you've exhausted all of the conservative modalities first. So we generally recommend you try anti-inflammatory medications, physical therapy exercises, injections, and the like in order to maximize those chances of getting those conservative modalities to work. But once you've exhausted the conservative modalities and you're ready to move forward with surgery, a partial knee replacement is a very reasonable surgery for someone who has partial knee arthritis. And so if you're considering a partial knee replacement and you've been indicated for one by your surgeon, that's a very reasonable path to take. Now, there's always the question of, can I wait too long to have this procedure done and therefore miss my window and end up needing a total knee replacement? And I would say that's very rare. Theoretically, yes, if you wait too long, say years and years, could you develop arthritis in the other compartments? And theoretically, that's true. But normally what we say is if we're indicating somebody for a partial knee replacement, it's because they've got a pattern of partial knee arthritis and the patient's a good candidate for that surgery. So I think it's always important to maximize the conservative options first before just jumping into surgery.